Hello, my dear friends. Hope you all are here and hope all of you have joined the YouTube link. Yes, just waiting for the others. Hello, Frostat. Hello, my dear friends. Hope you all are. Yes. Yes, let's just give it a minute or two for the students to join up because we are just in the process of sharing the links to the WhatsApp groups. Just a moment, beta. Just allow me some 2-3 minutes more time. Hello, beta. Thank you. Student FMGE, thank you. Hope yesterday's exam went pretty well. Although few bouncers were there, paper one is comparatively bit tougher. Yes, Garima, thank you for joining, beta. Let's give it a minute or two for the students to join. Still, they are joining. So just wait for another 2 to 3 minutes to start this session. Malik, thank you for joining, beta. Nishant, thank you. Hitesh, thank you so much. Good afternoon. Yes, the students are joining. Just one more minute, guys. Let's just wait for the students to join up. Yes, Alok, Assamese girl. Yes, thank you for joining. Kanupriya, thank you. Welcome. Deepinder, welcome, beta. Thank you for joining. Kamini, Neon Pro, thank you, beta, for joining. Yes, it is all your efforts to come up with the recalls so that we can actually have this session first of all. Yes, Febin, Kamini. Yeah, just a minute more, then we shall start with the session. Ajil, Wasim, thank you, beta. Thank you for coming live. Hello, beta Mohammed. Yes, Nishant, mostly the recall we will try to keep the essence intact. So, okay. So, without wasting much time, let us now straight ahead start with this. Okay. So, yesterday's paper, if you ask me honestly that what was the index of the toughness of that paper, I will rate it as moderate to almost little bit on the tougher side. But yes, the topics that were asked in yesterday's exam, that was pretty much common, and usually those are the high yielding topics from where in the MCQs it is basically asked. So although they have gone this time in little bit detailing of the topics, but the way we have taught you guys in the classes of MIST, as well as the way you guys have understood in forming the concept during the classes, I believe all of you would have been intelligent enough to filter out the odd ones out, and you definitely would have marked the right answers in the yesterday's FMG exam, my dear friends. So it was bit of a moderate paper. If I ask you honestly, all of you will be in favor that paper one was not that much expected what you had, because a lot of questions were there from also from the clinical subjects. Many of these things were overlapping, and usual the direct questions that are asked in the exam was asked in the form of little bit twist. And basically we should also be in a position to read between the lines, my dear friends. It is no longer the bouncers, no longer the one liners that will fetch you the marks. It is all your concept, my dear friends. Now we have come to a position where we as an FMG graduate appearing for the licensing exam, you should be in a position to learn how to read between the lines, my dear friends, because the older days questions are no longer asked as a flat out ones. They try to put it with sort of twists. Although the crux of the story they try to remain intact, but they will try to make you, I mean, distorted, as well as they will try to make you little bit jumbled up with lot of other unnecessary info. So you should be in a position to filter out the odd ones. And let us try to first have this session. And there were around 17-18 questions that were asked from biochemistry. We will try to recall. Although in the short span of time, with your efforts, I sincerely thank the team MIST as well as those students who has also helped me out to come up with the recall as much as possible. In the MCQs that I will be showing you in a while, please try to understand I have tried to keep the essence of that MCQ intact, but the exact language of the question might not be exactly same what you would have seen in the computer screen in yesterday's exam. But yes, more or less the story I have tried to keep it intact, more or less the essence is also intact, and the topics that we have discussed during our session at biochemistry, where we have told you guys many times that expected question EQ topics, this time lot of EQ topics or expected question topic also has come up in your exam. So without wasting much time, let us straight away discuss the first question that I could recall from this session. First MCQ, my dear friends, try to focus over here. First MCQ, just a moment beta, some glitch in the screen. Just a moment guys, just a moment, some glitch in the screen. Yeah, I hope now the things are seen, and you guys can see the first question as well. Some glitch in the screen was there beta. I hope now it's got rectified. Yes, so yes, waiting for answers, my dear friends, waiting for your answers. Let us try to have a look at this question. And I believe the language was somewhat like this, and the topic, expected question topic that we have discussed during our classes. So waiting for the answers, my dear friends. A neonate few days after birth suddenly becomes lethargic. They also try to cook up some story, and the main crux of the story that they had focused in the exam, my dear friends, the main crux of the story, my dear friends, all of you are coming out with the right answers, that there is refusal to suck breastfeeding. Yes, yes, my dear friends, yes, all of you have marked this one correct, my dear friends. Yes, 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 the main crux of the story was like this. Yes, my dear friends, there was this starts refusing breastfeeding, forced vomiting. Please try to understand, diarrhea on the third day was not given, okay, exactly, but they did mention about this important oil drop cataract. Yes, my dear friends, so these two, oil drop cataract and refusal to suck the breastfeeding, we have discussed during our classes at MIST. The answer has to be this galactosemia. They had marked this one also as classical one. I believe these are the other options that probably was there. Maybe the options are not matching exactly, but the essence of the story is almost intact, my dear friends. So there was a question on galactosemia, and I told you many times that galactosemia this time is an expected question. If you try to just have a quick look at our workbook pages, my dear friends, we have seen that galactose metabolism. During the discussion at classes, I had already mentioned that this is an EQ, my dear friends, expected question. and coincidentally this has come this time in your exam, my dear friends. Try to focus. We have discussed about the pathways, we have also seen some one liner question, and we have also talked about this very important point that breastfeeding is actually contraindicated in patients of galactosemia, and the main hallmark of the story is that there is refusal to suck the breast milk but accepting plain glucose water. That's why dextrose solution through oral route is also given as one of the treatment. And we have seen that the mechanism of the formation of this oil drop cataract, that excess galactose comes out of the liver, travels via blood to our eyes, and in the lens we have an important enzyme, my dear friends, known as aldose reductase. Yes, we have discussed about this enzyme aldose reductase. This is an enzyme that is absent in the liver but it is present in our eyes, and this is the culprit enzyme that causes the cataract, where galactose is getting converted to galactitol or dulcitol, my dear friends, and this deposition in our lens basically forms oil drop cataract. It is little bit late finding, mainly seen minimum after 5 to 6 months of the age, but sometimes can present also early. So this was asked in your exam, my dear friends. Usually they ask you these enzyme deficiencies: gal1 put, galiput, galactose 1 phosphate uryl transferase. That is the best option as compared to the galactokinase deficiency. So these points we have discussed, and important beta, whenever any faculty is telling you expected question, do not miss those. So hope all of you have got this one correct, my dear friends. Right, infos were provided during the classes. I hope you could do this without any hitch. Now looking at the next important question, looking at the second important question, my dear friends, please try to have a look. Yes, the story I have cooked up from my side, it might not be the exact same story, but the crux of this was also kept intact. Yes, I believe this sort of question came in your exam, my dear friends. Try to focus here, beta. Right, waiting for the answers, waiting for the answers. Also an expected question topic, we have discussed this in our class, my dear friends, in our carbohydrate metabolism. Yes, in the HMP shunt pathway we have also discussed about those trans catalase, an important role of vitamin B1, deficiency of which causes Wernicke-Korsakoff syndrome. Yes, yes, all of you, Rishabh, Frostrat, Ajil, Kanupriya, Garima, thank you so much, my dear friends. Yes, the crux of the story. Yes, try to focus here one more time, my dear friends. Chronic alcoholism, history was given. This has been confirmed by many students, my dear friends. There is weakness and lethargy, and also there is an history. Please try to understand vague stories that are not entirely true, that might be a part of confabulation. We have discussed about Wernicke-Korsakoff syndrome, that is Goa, my dear friends, mnemonic Goa, global confusion, as well as ophthalmoplegia, that is seen as nystagmus, and ataxic gait. So those things are also mentioned over here. Global confusion, to and fro movement of the eyeball can be regarded as nystagmus, and failure of hand and eye coordination and walking in a straight line, that might be a difficulty that is due to some gait disorder. They have also used this word, many students has confirmed me this. There was that question like immediate or emergency management. For this, all of we know, we have to go for IV thiamine. We have to go for IV thiamine, my dear friends. So the answer to this question, without any doubt, important point, try to focus. Most common cause, chronic alcohol intake. Yes, ध्यान देंगे इस चीज को बेटा. Try to focus on their friends. Many students has confirmed this chronic alcoholic patient, gait disorder, and these three classical finding: emergency, immediate management. Emergency, immediate management. Yes, this question has come, my dear friends. Many students has confirmed this, and please try to understand, we have discussed this point. Also another EQ topic, my dear friends. See, EQ, another expected question topic written from our biochemistry notebook workbook. We have discussed in our carbohydrate metabolism, two parts, Wernicke encephalopathy and Korsakoff psychosis. There was Goa, this was mentioned, and also they had mentioned about this confabulation. Diagnosis was syndrome, Wernicke Korsakoff syndrome, my dear friends. Please try to understand this. We have discussed this, and we have also written down that most common cause, it is due to the chronic alcohol intake. So all these things, important point, my dear friends, important chronic alcohol intake. Try to focus. This was an expected question topic, but again beta, two EQs I'm showing you first. This was expected this time and it has come, my dear friends. Please try to understand this. Yes, hope all of you have got this one correct. This time they did not ask that bouncer of delirium tremens, that also we have discussed during our biochemistry session. So try to remember, important question. First thing first, let us move to some easy ones that were asked as a direct one line, again from our biochemistry workbook notes. Please try to focus. This was a simple, I didn't get much of the history about the literature, but this thing was there and intact. There was some foreign body in the, I believe this question, my dear friends, please try to understand. Many students has confused me with this, that few students actually told copper and few students actually told iron. Please try to understand. Few incidences I have got this one. Instead of iron, they had given it as copper, my dear friends. Try to focus. I need your help to understand this, my dear friends, which was the exact thing. Few students told me this is iron, they had asked. Few students told me, so no sir, they have asked about copper. My dear friends, if it is copper, please try to understand presence of copper as foreign body in the eye. We have discussed in our classes, the answer has to be chalcosis. Yes, yes, Vinita, I believe, yes, please try to understand, my dear friends. What was the question, my dear friends? Yeah, there was a confusion between them. Few students told me copper, few students told me iron. So for iron, this will be sidrosis bulbi, but in for the copper, my dear friends, we have discussed it is chalcosis. So depending on that, we can remember this, my dear friends, that what was the question that they had asked. Try to focus. Chalcosis part we have discussed. Depending on the element that they had asked, the answer will be marked like that, beta. In the chalcosis, we have also discussed that in our classes. Please try to understand that whenever we had discussed about those Wilson's disease, in the Wilson disease, we have discussed that there is intraocular foreign body containing copper is called as the chalcosis. So if they have asked the question as copper, my dear friends, without any doubt, the answer will be chalcosis, my dear friends. Okay, so some confusion. Okay, so if it is iron, then the answer will change accordingly, that we have already discussed. But if it is copper, we can safely mark the answer as chalcosis. So controversial question, whatever it was asked, I leave it to you guys for your best knowledge. Thank you so much. Moving to the fourth question, my dear friends. Fourth question, my dear friends. Try to focus. Fourth question. Iron, yes, many of you have confirmed me iron. Okay, so answer will change according to that. Thank you all for giving me an honest feedback. No copper, sir, iron was there. Okay, coming to the fourth question, let us see this. Let us see this, my dear friends. Yes, Dhruv, I believe you 100%. Yes, waiting for answers. Handsome doctor, my dear friends. Yes, answer to this question number 4. 3 is already gone. Try to focus. Let us quickly see this. Which of the following mineral is best known for stabilization of the insulin secretion, my dear friends? This was actually a direct question which came in the previous years, my dear friends, and the answer of this question, as the word is stabilization, my dear friends, then the answer has to be zinc over here. The answer has to be zinc. Yes, yes, D. Yes, D. Yes. All of you are right, my dear friends. As the question has been stabilization, my dear friends, answer has to be zinc. This has been taken from the last page of our biochemistry workbook, my dear friends. Last page, last line of our biochemistry workbook. This MCQ was mentioned for your self reading. If you just try to recall in the biochemistry workbook, page number 110, some MCQ points regarding minerals, and in the last line this was there, my dear friends. Last page of our biochemistry workbook, we have got 4S: synthesis, storage, stabilization, and secretion of insulin is done by zinc. However, they also ask you one more question in your exam, my dear friends, that is the chromium. Please try to understand. For chromium, this is potentiates the action of insulin, and that's why in impaired glucose tolerance, it might be due to the chromium deficiency. So they did not use the word as P, not the potentiates. They had asked. Please try to understand. Try to focus here, my dear friends. Synthesis, storage, stabilization, and the secretion, as the word over is stabilization. Yes, all of you are correct. Yes, you have marked the answer as zinc, my dear friends. So this was also there from the notes, although during the classes we did not discuss about this, but this is mentioned in our workbook, my dear friends. Stabilization word. Try to focus. Moving to the question number 5. I believe this was definitely there because I have received this question from multiple students, my dear friends. Multiple. Try to focus here, beta. Question number 5. Yes, waiting for the answers. I guess there is some delay in the beaming of the lecture. Try to focus here, beta, first. Yes, my dear Deepinder. Yes, the answer is right. Deepinder, answer is right. Yes, now the options are coming. Yuasim, cysteine was also there. Okay, I will make a note of this. Thank you, beta. Cysteine was there also in one of the option. Yes, but all of you have told me the correct answer, my dear friends. The answer is B. That is our aspartate. This is again directly taken from the workbook we have discussed. If you recall, my dear friends, we have discussed about an important reaction in biochemistry that is called as transamination, seen in our liver mainly, as well as in our skeletal muscles, to some extent also in our RBCs. Try to understand. Oxaloacetate is coming from aspartate. Yes, aspartate. सही लगाया है बेटा, एकदम निशांत सही लगाया है, टेंशन मत लो, आंसर सही है. Answer is aspartate only. Yes. Cysteine, although might have been there, one of the other two options might be cysteine, but cysteine is not there in the option. Try to focus here, beta. Answer over here is aspartate, my dear friends. Just to make you remember, in the page 59 of our biochemistry workbook, we have discussed about this transamination reaction, Brownstein-Kriessmann reaction, and we have discussed multiple time, my dear friends. If you remember, there was an enzyme called as AST, also called as SGOT, serum glutamate oxaloacetate transferase. This oxaloacetate transferase, by the help of glutamate, can also regenerate our aspartate. We have discussed this point, my dear friends, that this sort of transamination reaction, try to focus, my dear friends, can convert alanine to pyruvate, pyruvate to alanine, aspartate to oxaloacetate, oxaloacetate to aspartate. I'm talking about this reaction, my dear friends. Oxaloacetate can be converted to aspartate, and we have discussed also when this side will be preferred, that due to negative nitrogen balance reaction can reverse, and due to positive nitrogen balance the reaction can move in the conventional direction from alanine on aspartate towards pyruvate and oxaloacetate respectively, right? So aspartate is the right answer, beta. Even if you have made an educated guess, the answer you have made it correct. And this topic we had also discussed. I told you urea bicycle is a latest concept, and in the urea bicycle we have discussed that whenever that fumarate was coming out of the urea cycle, it can get converted to malate, malate to oxaloacetate, and oxaloacetate can be transaminated to aspartate. So either from both of these two topics, I guess all of you would have remembered this. Whenever you get stuck in the exam hall, try to recall and try to go back to the classes that we have discussed. Answers will come from the classes, my dear friends. We have discussed these points multiple times during our classes. Whether you choose the answer from transamination, whether you choose the answer from the urea cycle, doesn't matter, the answer is correct. Oxaloacetate can be transaminated from the aspartate also. That part we have also discussed, my dear friends. Try to focus, right? Great. Moving to the next important question. try to keep the essence intact. Exact story might be little bit tweaked in the exam. Yes, Nishant, thank you. Yes, sometimes pictorial explanations students try to recall more. Yes, now waiting for the answers. Yes, number 6 beta. Number 6 waiting for the answers. Many students has confirmed me about the options. Few of you also could came up with the exact history. I have tried to cook up some story from my side just to give it a dhacha or the framework of the question, but I hope that all of you could come up with the right answer in the chat box beta. Let us try to make this session as much as interactive as possible so that we can also learn from our mistakes and we can frame the exact question. Beta Afzal, no, the answer was not homogenticate oxidase beta. As you guys can see, this is actually a case of homocystinuria that we have discussed in our classes. I'm waiting for a few other students to come up with the answers. I believe many students would have definitely marked this answer as correct, my dear friends. Try to focus on this homocysteine word, my dear friends. Homocysteine word. Try to focus beta. Nishant, this question was actually asked beta. This question was that maybe the language of the question is exactly was not like this. That's why you are not able to recall. Try to focus. Yes. C. Yes. Yes. Ashima. Yes. Nand. Ajil. Frostrat. Sushant. No, Sushant. The answer is not B beta. The answer has to be C. Dr. Megrat. Yes. Try to focus, my dear friends. Yes, C लगाया है तो आंसर सही है बेटा. Please try to understand, my dear friends. The answer of this question is definitely C. Yes, cystathionine beta synthase. This was a case of homocystinuria, my dear friends, that we have discussed. Maybe the history was not somewhat like this, but they did mention about these points that there was an increase in the homocysteine concentration. Few students also told me they asked something about the rate limiting enzyme type of question in this particular cystathionine metabolism as well as in the sulfur containing amino acid metabolism beta. In this cases, the answer of this question, best answer. Try to focus, my dear friends. These are actually cystathionine beta synthase. Cystathionine beta synthase we have discussed during our classes at Miss Beta. This is CBS. Cystathionine beta synthase is the most important rate limiting enzyme of the sulfur containing amino acid metabolism. Try to focus, my dear friends. Important point. This portion we will just try to recall from our notes. We have discussed this point. If you recall, during our discussion of this homocystinuria topic, in homocystinuria we have seen that some vitamin deficiencies as well as some enzyme deficiency can call this. So classical homocystinuria we have discussed, that is a deficiency of the cystathionine beta synthase. Cystathionine beta synthase, my dear friends. Try to focus. Understand this point beta. It might be Marfan syndrome. Yes, because Marfan syndrome and homocystinuria, lot of cases, lot of clinical features are getting shared between them beta. We have also studied the mnemonic. They look as Marfan but also show other great complications, right beta? So this was there. Many of you might not able to recall this, but this question was there, my dear friends, because many of you has told me that there was an answer of one question, that was cystathionine beta synthase, CBS, cystathionine beta synthase, my dear friends. Yes, try to focus. Yes, next one, coming to the number 7th one. Try to look at this question, beta. I hope you guys can remember this. Yes, Wasim, answer you have chosen is right, beta. Yes, Wasim, you are right. Yes, answer is right, my dear friends. Kanupriya, yes. Dr. Danger, yes. Archit, beta, this question was there because many students had confirmed me that there was a question about the location of the cardiolipin. Yes, answer was cardiolipin. Okay, something related to cardiolipin has been asked. Try to understand. Inner mitochondrial membrane. Yes, okay, Mohammed, you are remembering that maybe there was no inner outer, but mitochondria was there in the option. So yes, we have definitely studied during our classes that cardiolipin was the answer because it was present in the mitochondria, my dear friends. Mitochondria. Let us try to revise this point. Cardiolipin we have discussed. So the essence, as I told you earlier, exact MCQ might not be same what you would have seen, but please try to remember the essence. We have tried to make it intact. Yes. So this was there. Cardiolipin is the answer of this question. Try to recall in our lipid classes we have discussed that in the clinically important phospholipids and glycolipids, please remember cardiolipin is actually a phospholipid that maintains the integrity of the inner membrane of the mitochondria, and this is important for the electron transport chains execution, right? Answer was cardiolipin. Yes, okay, so we need to rephrase the question a little bit in a way so that the answer becomes cardiolipin. Only mitochondria was there and cardiolipin word was there. Okay, might not be about the parts of the mitochondria, but please remember cardiolipin is found in the mitochondria itself. Trying to move to the next question. More than a handful of students has confirmed me about this question. I believe that you all can just try to remember that this question was asked and you can come up with the answer. Actually, what happens whenever you are exposed to 300 MCQs, it is difficult for all of you to recall all the things. That's why we are discussing over here to come up with the best possible recall, my dear friends. Yes. Okay. Yes, Dr. Jane Danger. Yes, the answer is yes. Yes. Yes, my dear friend. Directly from the workbook notes. Repeat question. This was also asked earlier in 2020 August FMGE exam. Earlier this has been asked. But this is actually recall from the FMGE itself. Might be it has come in the NEET PG, but this is the same recall. Just 3 years back they have asked this question during the lockdown. 2020 August FMGE exam also they have asked this question. So it is a repeat question just 3 years back, my dear friends. The answer is this. Please try to understand. GM1 ganglioside, beta, GM1 ganglioside, it has been directly taken from our workbook notes. Try to understand. Cholera toxin, intestinal mucosa. If you recall, my dear friends, in the ganglioside, page number 83 of our workbook, we have discussed page 83 of workbook lipid chemistry and metabolism. Under that we have clearly written this one as an LQ. See, it has already been asked, my dear friends. GM1 present in intestine, 1 with I with I told you to also remember this. I with I, intestine allows entry of cholera and tetanus toxin through the intestinal mucosa. Yes. Repeat question, my dear friends. Repeat question directly from the workbook. Try to focus. Moving to the next question. It has taken some time for me to frame this question, but I hope the essence has been kept exactly intact. Yes, those who can remember, try to solve this. Yes, this was 100% asked in the exam. Try to understand. Srishti, the answer of that question was actually A, beta, GM1 ganglioside. It is a repeat question. All from the workbook of MIST, all from our workbook. Yes, waiting for the answer. Yes, this question was there. Answer of this question, my dear friends. Hint is there in the MCQ itself. We have discussed during our classes. Colorless, odorless. Yes, we have mentioned here the word as odorless because all the students confirm me two things. That there was a child accompanying father, fish farming area. These are the words that has been asked, my dear friends. Try to understand. And accidentally develop toxicity of the drug, some sort of question we have cooked. And please remember, in our classes at MIST we have discussed that this is rotinone, my dear friends. Rotinone, yes. Try to focus, my dear friends. Rotinone is the correct answer of this because rotinone, my dear friend, is actually considered as fish poison. We have discussed this in our classes. Rotinone, not C beta, not C beta. The answer here over here is this rotinone, because rotinone, my dear friends, is actually considered as a fish poison. Fish poison, my dear friends. Try to remember this point we have discussed. Expected question topic again, my dear friends, from the workbook, page number 18 of biochemistry workbook. Expected question topic, inhibitors. They have this time asked about complex 1 inhibitor, my dear friends. Complex 1 inhibitor. Usually they ask you question from complex 4 inhibitors, cyanide, carbon monoxide, all those, but this time they have asked about complex 1 inhibitor, directly taken from our notes. Look at the third one, rotinone, roten. Alka-Cheers, roten piercin bar. Rotinone, my dear friend, is considered as a fish poison. Try to focus. Beta, yes, that was another question we will discuss that has been asked, that regarding that British anti-Lewisite or the BAL. There was one more question from the BAL that blocks the complex 3. That is another question we will discuss at the later on. Beta. The combination was given as rotinone and inhibiting like all of the following except type of question, right, Archit? Which is wrong. Okay, which substance inhibit complex 3? See, if they asked about complex 3 inhibitor, complex 3 basically we have got 3 blockers beta. One of them is this antimycin A, then BAL, British anti-Lewisite, and we also have got N-ethyl malimide. That is, those are the 3 inhibitors for the complex number 3. Here 2 things are written over here. So if they have asked about BAL, I thought of discussing that in another question because I have counted that one also as a separate question. Might be both of them has been asked together, right? So rotinone. All of the following correct. All of the following correct. Okay, so this sort of question has been asked. Yes, BAL is a complex 3 inhibitor, my dear friends, British anti-Lewisite. Yes, thank you all for giving me the feedback. Try to focus. Yes, I believe this question was also there. Beta, BAL is not complex 2. Hello. Yes, many of you are getting confused, beta. Just look one more time, beta. Complex 3 inhibitor example is British anti-Lewisite, BAL in short. Complex 2 is malonate, carboxyl and phenyl trifluoroacetone. These are the 4 complex 2. Don't get confused between 2 and 3. If they have asked about British anti-Lewisite, it will be definitely an inhibitor of the complex number 3, my dear friends. Okay, moving to the next question. Okay, beta. Let us try to quickly see this. Try to focus. Question number 10, beta. I hope this was there. Somewhat history, maybe some other important points were there in this question, but I have tried to again keep the main essence intact. Yes, 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 yes. This question was asked and all of you are coming out with the correct answer. Yes, this is due to deficiency of the zinc, my dear friends. Acrodermatitis enteropathica. Acrodermatitis enteropathica. Yes, Dipesh, right. So they had mentioned about alopecia, dermatitis, and diminished healing. All these three things can be seen in the zinc deficiency, my dear friends. Acrodermatitis enteropathica. Right. Without wasting time, let us go to the next question. This is a question when I have received multiple feedbacks, my dear friends, and this is literally a confusing one. There was so many doubts regarding this particular question to remember or recall the exact language of the question, but I have tried to collect as much as info from you guys. Try to focus better. Try to let's just quickly recall. I hope that the mention of the 5-fluorouracil was there. Some it is getting converted to its active form, and destruction of the cells are there. Like which type of inhibition? A few of you told that this last suicide inhibition or mechanism based inactivation word was not there. They had used the word irreversible, reversible type of things. So I hope that more or less this was the question that has been asked. Try to remember and recall better, my dear friends. See, I mean, actually, if you ask about 5-fluorouracil, if you go by the textbook, if my dear friend this question was asked, and I also believe that they had mentioned about some graphs. Try to understand better. I don't have the access to the exact graph, because there was mixed type of graph sent by the students to me. That yes, Mir Hamid, yes, 5-fluorouracil is an analog of uracil was written. Okay, thank you beta, thank you for this honest feedback. Right, 5-fluorouracil. Okay, reversible, irreversible, allosteric, and uncompetitive, my dear friends. Please try to understand. Usually 5-fluorouracil, that is known to block our thymidylate synthesis, that is actually included under competitive inhibitor, my dear friends. Just taken screenshot from the biochemistry textbook, my dear friends. Clinically useful competitive inhibitors. In that list you can see they're starting from allopurinol, xanthine oxidase, dicumarol, vitamin K, epoxide reductase enzyme, penicillin, all those transpeptidase. If you see in this list, if you scroll down, my dear friends, in the point number 9 we are seeing that there is 5-fluorouracil. 5-fluorouracil, it is blocking the thymidylate synthesis. I just now told you the name. This is used as an anti-cancer drug, my dear friends, and this is actually in the list of the competitive inhibitor. So 5-fluorouracil is actually a competitive inhibitor. But in the question, many of the students has told me some history that it has been converted further to its active form. Like those sort of things are little bit confusing, my dear friends. Try to focus better. Actually, if you go by the textbook, 5-fluorouracil, it is considered as a competitive inhibitor, and competitive inhibitors are mainly of reversible nature, but few of them can also be irreversible. Those are tough question, my dear friends. Try to understand. Reversible and irreversible version, beta, it is a tough question. Honestly speaking, it depends on the examiner that which answer they want to choose this one as a correct one. Please try to understand. Overall, this is a competitive inhibitor. I just now shown you this is in the clinically used as competitive inhibitor. One of the example is this 5-fluorouracil. So based on that, depending on the option, we have to choose, beta. Yes, if you go by these four options, then we have to choose this. But if you talk about reversible, irreversible, then based on that we have to choose those, right? So depends on the recall of the correct options that we have got. But try to remember that 5-fluorouracil is actually a competitive inhibitor to this thymidylate synthesis. Few of you have told me maybe they have shown you these graphs, but these graphs also actually relates to some suicide inhibition, my dear friends. There is something called a suicidal inhibition. Like allopurinol basically gets converted to alloxanthine before they inhibit the xanthine oxidase. Although we commonly know xanthine oxidase is inhibited by allopurinol, and I have just now told you that allopurinol is also blocking xanthine oxidase, listed in the list of competitive inhibitor. but actually allopurinol doesn't block xanthine oxidase. Allopurinol gets converted to alloxanthine, which then blocks the xanthine oxidase, my dear friends. Please try to understand that sort of inhibition is called as suicide inhibition, which is also called as mechanism based inactivation. So this sort of things were there, but beta, try to focus, my dear friends. Suicide inhibition or mechanism based inactivation might be the answer. Might be, I'm using the word might be, because if they have mentioned this sort of history, that the inhibitor is getting converted to its further potent form or further active form, whenever one inhibitor gets converted to another potent inhibitor, that sort of concept is called as suicide inhibition or mechanism based inactivation. But as all of you are confirming me now in the options that this suicide inhibition or mechanism based inactivation was not there, that means most likely this active form conversion was also not mentioned. Then in that we have to choose from competitive or depending on the reversible or irreversible. So try to focus. Controversial question, try to remember, my dear friends. Yes, so let us move to the next question. Hope there is no confusion. This is an easy one which all of you will be able to correctly recall or remember. Yes, some graph was there, beta. Yes, Hussein, some Wasim, beta, some graph was there, but I don't have the expose. If you guys remember, all of you have my WhatsApp number, you can just share me the graph exactly. Even if you look at some place, try to focus, beta. Look here, this question definitely was asked. Yes, yes, yes. Priyanka, Afzal, Deepesh, Jish, all of you. Yes, Nanda, all of you, beta. Sushant, yes, all of you without any doubt. Yes, all of you agree with me that delayed wound healing was there, and there was also mention of gum bleeding. We have been studying this question since ages, and the answer of this, my dear friend, has to be vitamin C. Yes, vitamin C, directly taken from our notes during our collagen classes. We have discussed about the scurvy, and in the scurvy we have discussed about vitamin C. Beta, vitamin K question is different one. We will discuss in a while. I will be showing you in a while, beta. Wasim, I will just show you. Yes, please try to focus to the next question. Yes, I think you guys are remaining. Wasim, beta, I think you are referring to this question. Wasim, where did he go? Where did he go? He has vanished. No, he is there. Wasim, yeah, I think you are talking about this question, beta. This question, that some vitamin K related question. Yes, try to recall this one. Beta, there were two question. Don't get confused. One was vitamin C, another one was vitamin K. The answer of this question is vitamin K, my dear friends, because please try to understand, bleeding disorder and also to found to have dental caries. All of you know vitamin K2 is actually given as a supplement for the treatment of the these dental caries. So please try to understand here. Yes, 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 here the dreamer danger. Yes, Sushant, yes, my dear friends. Yes, here the answer of this question is vitamin K. So there was two questions, one from the vitamin C and vitamin K, my dear friend. Vitamin K is an expected topic. Try to understand. Usually there will be question. Bleeding disorder, dental caries. Please try to understand most appropriate. Treating this condition, we have to give the supplementation of the vitamin K. Remember vitamin K2. Remember, beta. Please try to remember this point, beta ji. That vitamin K2. Let me write it clearly, beta. Vitamin K2 is actually given for the dental caries. It is actually given for the dental caries, beta, right? History of, beta, this was two question actually. There was one question of delayed wound healing, gum bleeding. In that question there was no mention of dental caries. Another question there was mention of bleeding and there was mention of dental caries. Two different question, beta. That's what we guys have been able to. She attended surgery as well as some small bruises cause type of appearance. So they gave some history of this sort of bleeding or petechial hemorrhages probably, or ecchymosis, something like that. Okay, thank you, beta. Moving to the next question. Beta. Try to quickly see this next question. I few students has confirmed me this, that they had asked some question regarding this beta, something related to this delta ALA. The key word in that question was that some delta ALA. Try to look at this question beta. Try to look at this question beta ji. Afzal, you are right beta. If this question has been asked, because few students has told me this, that there was a question of the rate limiting enzyme of the heme synthesis pathway directly taken from our notes beta. We have discussed that delta ALA synthase, my dear friends, delta ALA synthase is the correct answer. Yes Srishti, yes, synthase, delta ALA synthase, yes. Try to focus here beta. Yes Siddharth, thank you beta. The answer of this question is B. Yes, B. Delta amino levulinic acid, that is in short called as delta ALA. That is the first product of the heme synthesis pathway. Succinyl CoA and glycine together, they are added by delta ALA synthase. This is the rate limiting enzyme we have discussed, and we have also discussed that this is dependent on two things. One is vitamin B6, another one, my dear friend, is copper. Try to understand delta ALA synthase, ALA synthase. Yes, ALA synthase, Kanupriya. So this question has been asked beta, ALA synthase, ALA, amino levulinic acid synthase. Yes Nanda, the answer is B. If you have marked the answer as B, without any doubt you will be getting 1 mark, right? Thank you all beta. Thank you. Please try to see this delta ALA, delta ALA. Please remember, we could not frame exact question about this. Try to understand. We could not frame exact questions. Try to focus here beta. Some feedbacks. Try to understand. Look here, my dear friends. Try to look here. Hamid, I will try to keep this in consideration what you have posted here. So definitely. Lithium was also mentioned. Okay. ALA synthase in that case will be the answer beta. Try to understand. So there was some question, we have got only half-hearted information regarding this. DNA present in which cytoplasm? What was the exact question beta regarding the 15? Anybody, if they recall, you can just try to help me out with this. Beta, we will talk about this this one, this now, not the gout. This is not a question of gout. This will basically go for the psoriatic arthritis. Try to understand. There was a question on those psoriatic. Try to understand, my dear friends. Psoriatic arthritis, psoriasis. Yes, there was a question of psoriasis beta. Try to focus. So that question we will not come to biochemist. That's why we have not counted that. There was some history about wrist, ankle, leg, but not that one. DNA is present in which organelle, my dear friends? Kamini. Then DNA, please try to understand, it is basically present in our nucleus, and we have also one special type of DNA that is called as mitochondrial DNA. Please try to understand, if they have asked about which organelle, the nucleus will be a better answer than the mitochondria, because mitochondrial DNA, it is only 1% of the total cellular DNA, my dear friends. Most of the DNA is basically present in our nucleus itself. Lysosome, cytoplasm, mitochondria, endoplasmic reticulum. Okay, let me write down this one. Lysosome, cytoplasm, mitochondria, and endoplasmic reticulum. If you have these four options, Siddharth, thank you for showing me and remembering these options better. Yes, if there is lysosome, cytoplasm, mitochondria, and endoplasmic reticulum, our answer will be mitochondria, my dear friends, because mitochondrial DNA refers to 1% of the total cellular DNA. Yes, Yes, my dear friends, thank you for this recall. So question number 15 also we are able to recall correctly. That question, that BAL, okay, nucleus was not present, that means the answer will be mitochondria. Please try to understand. Mitochondrial DNA is responsible for only 1% of the total cellular DNA. सेल के अंदर जितना भी डीएनए रहता है बेटा, उसका वो केवल 1%, सिर्फ 1% is present in our mitochondria, and it is a closed circular piece of double stranded DNA beta. It is very much special. Mitochondria is actually able to code for this DNA, and all mitochondrial disorders are due to this particular mitochondrial DNA only, and it is actually inherited maternally. Always M for M, maternal, mitochondria, so many M's are there. Please try to understand for the mitochondrial DNA, my dear friends, right? So 1% answer has to be chosen as mitochondria. Great, thank you. That's the idea of this recall, so that we can come up with the correct options. Please remember the question number 16. If there was an overlapping one, so we have already targeted that over there along with that rotenone. I told you BAL, basically my dear friends, this will be going for blocking complex 3 inhibitor. This will be mainly for the complex 3 inhibitor beta. That question we have already targeted earlier. Yes. Yes, Muskan, that question that you are referring to, where the options were pseudo gout, secondary gout, and I believe that was actually a case of psoriasis, because that will be going to the subject of medicine. So once the medicine recall is done, please try to understand. You might have to wait for that, because there was no mention of the knee joint. Please try to understand, my dear friends, better. Where there was no mention of knee joint. If they would have mentioned knee joint, then we could have marked the answer as pseudo gout. In pseudo gout, my dear friends, we have discussed during our classes. In pseudo gout, there is basically involvement of the knee joint. But many of you have confirmed me this, that in that question there was no mention of the knee joint, so it can't be pseudo gout. But iron deficiency anemia question will be taken care by the pathology faculty beta, because that will be a section under hematology. So I will not go into that. Try to focus beta. Gout question was there, and psoriasis question was there in paper 2. Oh my god, that is a bouncer now. Oh my god. If there is a question on the gout beta, they would have definitely mentioned about some first metatarsophalangeal joint podagra, or some needle shaped crystals with negative birefringence. Pseudo gout means rhombic shaped crystals with positive birefringence. In pseudo gout, knee joint is the most common one. In gout, it is the first metatarsophalangeal joint, or the great toe is the most common, right? So depending on the option. Okay, Sandeep. So psoriasis other question and gout other question. Okay, great. So this question we should not remove. Okay, this is another question that has come from biochem itself. Okay, not from this. Okay, noted. Thank you, beta. So based on the proper history, actually I'm lacking the proper history. Yes. So if you can, somebody can remember the exact literature of the question beta regarding this gout question, then we can remember. Psoriatic arthritis question came with the image. Okay, great. This is not an image based question, so I'm removing this psoriasis. So this question also will belong to our biochemistry itself, but we need the proper history. In case anybody recalls correctly, you all have my WhatsApp number. Please do share. I will be really thankful to you, my dear friends, if you can just come up with the correct answer. Remember the rule of thumb. Try to recall. If it is gout, it will be podagraph, first metatarsophalangeal joint, great toe involvement, needle shaped, negative elongation, negative birefringence. If it is pseudo gout, positive birefringence, rhombic shaped crystals. Most common joint involved is knee joint. Try to understand. Yes. Okay, okay. Thank you. But anyhow, if you remember that this question number 19 or something like that, you might try to help me out with this. Crystals, no mention of the crystals. And by if there was question, some disease with involvement of the small joints, my dear friends. Okay, okay. We will wait for the proper history. No problem, no problem. Thank you, beta. And see whether this question was asked, beta. Was there any question on the vitamin B12 deficiency? Some lady presenting with anemia, they have either used the word as microcytic or megaloblastic, anything like that. Was there any question? Leg problem, ankle problem. Okay, okay, okay. Okay, needle shape, negative elongation was not there. Understood beta. Was there any question on this? B12, anemic lady, macrocytic megaloblastic, macrocytic megaloblastic. Okay, not the conventional history of gout. Maybe they have found out some new type of gout, my dear friends. We have to wait for that. Okay, great. Distal interphalangeal joints involvement, DIP involvement, Kamini. Thank you, DIP. Okay, I will make a note. DIP involvement was there. Please try to understand. Yes, DIP joint was there. Okay, DIP joint. Okay, thank you. But was there any B12? Okay, no question on the B12. I believe nobody is coming up with the answers. Nobody is saying anything, so they don't recall this B12. Maybe some question was some anemic lady with B12 deficiency, something like that. And few of you were also mentioning about some tyrosine metabolism defect, some tyrosine metabolism disorder beta, anywhere from alkaptonuria or from type 1, type 2, type 3 tyrosinemia that we have discussed, or albinism, any such question. Where do you recall from tyrosine metabolism? Maybe from phenylalanine, phenylketonuria. Was there any question like that beta? Was there any question like that? uh, एक एक क्वेश्चन था, ब्लीडिंग हो रहा था, सीबीसी का डायमीटर, उसमें डायग्नोसिस बन रहा था. Okay, maybe it is not that clear. These symptoms were together. Okay, microcytic and hypochromic anemia is present. Okay, together. That will be mainly going for those hematology section beta. I get Kunal sir will be able to guide us better in that particular question, because yes, iron deficiency anemia beta, iron deficiency anemia, it will be going to pathology, it will be going under hematology beta. You have to wait for the Kunal sir's session, right? IDA clear cut, it goes under hematology. B12 deficiency, might be it is an overlapping topic. Okay, so I'm discarding this question, because anyhow this question will be going for patho. I am discarding this question number 17 beta. Was there anything from the 18? Was there anything from the 18 beta? Tyrosine metabolism, do you guys recall any question from there? Tyrosine beta, tyrosine metabolism, do you recall anything? Okay, no beta, hepcidin and all those things, it is clear cut hematology, hematology. Muskan, it will definitely go for hemat. Hepcidin, definitely hemat. Which drug will cause problem in tyrosine metabolism? That question will go in pharmacology beta. Without any doubt, that will be going for pharma. So these two I am discarding from biochemistry. That will be taken care by the pathology and the pharma teacher respectively beta. I will try to collect more information on this gout, because that will come. Acha, one more question that I just recall. Try to understand aspirin beta. These questions will be going for those cyclooxygenase pathway and all, that will be coming under pharma. One more question I just recalled, that there was a question on something like this beta. Just try to confirm me once, so that there was a question on some hormone sensitive lipase. Hormone sensitive lipase is inhibited by. Was there any question like this beta? Hormone sensitive lipase is inhibited by hormone sensitive lipase, but students has told me that there was no mention of insulin. Usually we have discussed that insulin is an lipotrophic, please try to understand, lipogenic hormone. Insulin will promote fatty synthesis, but they have asked about hormone sensitive lipase. Hormone sensitive lipase is actually an enzyme for starvation or for prolonged fasting, my dear friends. Starvation का enzyme है ये, है ना? We have discussed. Yes, there was one question that I did not write over here beta, but I just got an update that there was some question on hormone sensitive lipase. Do you guys recall the exact question beta? कि क्या पूछा क्या था exactly? Options नहीं याद रखे. Okay beta. Actually see, if the question is like this, it is inhibited. ध्यान देंगे बेटा, just try to understand for our knowledge, for our concept. It is mainly inhibited by insulin. If you talk about activation, my dear friends, first one definitely will be glucagon. Then we can remember beta epinephrine. You can also remember beta thyroid hormones. You can also remember beta ACTH. Please try to understand beta these 4 enzyme that I have just now written over here. ये जो 4 एंजाइम है ना बेटा, ये एक्टिवेट करते हैं हार्मोन सेंसिटिव लाइपेज को, जो हमारे एडिपोसाइट्स के अंदर रहते हैं. दोज हु आर प्रेजेंट विद इन आवर एडिपोस टिश्यू, दे आर एक्टिवेटेड बाय दीज 4, but they are mainly inhibited by insulin. But many students has told me that sir, insulin was not there in the option. So option I want beta, option if you can remember beta, then insulin. Shantanu, yes, insulin was not there. Yes, many students confirm me this. Insulin nahi tha. We all know hormone sensitive lipase is inhibited by insulin. It is activated by this 4 is causing activation beta. All of this is causing activation. Try to focus. These 4 are for activation beta. ये जो 4 है, these are for activation. ACTH था, yes yes, options I remember बेटा, ग्लूकागॉन, एपिनेफ्रिन, ओके, ग्लूकागॉन था, ACTH था, एपिनेफ्रिन था बेटा, एपिनेफ्रिन, इंसुलिन नहीं था, ओके. So little bit on the options we are getting stuck. If it is inhibited by, they should have given insulin. If the question is like all of the following can inhibit except, then type of, because these 4 are causing mainly activation. At least remember this info, my dear friends. Maybe in the upcoming exam it will be helpful. That glucagon, adrenaline, that is epinephrine, thyroid hormone mainly our T4, T3, and adrenocorticotropic hormone ACTH. These 4 are actually activating the fat breakdown, hormone sensitive lipase that breaks down our stored triacyl glycerol from our adipocytes. And insulin, it is not an hormone of starvation, it is mainly an hormone of anabolism, anabolic hormone, and it will basically promote the fat synthesis, right? So that is all, my dear friends. Inhibin option was there. Inhibin, okay. Inhibin, okay. GPR, AMP, GMP. Okay, inhibin. I will also try to write down this one beta. So these are little bit confusing options. Anyhow, we will keep an eye over the latest updates. If anybody recalls, hormone sensitive lipase, inhibin. Okay, so we'll try to recall all this. So these are the more or less question that has been asked beta. Most of the points, at least we can say that 15-16 MCQs that were directly asked from our workbook, and I hope that all of us can come up with the flying colors while the results are out. Okay, thanks for this healthy discussion to help me out. At least one question options we have got correctly. Another question that was supposed to go out of biochemistry has now come inside biochemistry. So these things we will try to remember. BAL question, I think it will go with that rotinone question. Maybe it was an overlapping one, but if there was mention about the fish farming and fish poison, then definitely rotinone will be a better answer than the this BAL, British anti-Leucide. British anti-Leucide actually one of the drug of choice for the mercury poisoning. During the World War II, they used to use this. That is in heavy metal poisoning में ये use होता था as a drug. BAL is actually a drug used for treating heavy metal poisoning. So nothing related to those fish poison. So remember, try to remember that fish poisoning was asked probably, and that was the answer. Okay, thank you all for giving me a patient hearing, and thank you all for joining this session in such a short notice. We have been able to come up with the few correct options during the session, and I hope that all of you can wait for this, my dear friends. Definitely big thumbs up for all the students, whether you are a Mistian or a non-Mistian, doesn't matter beta. But let us hope, let us be positive, let us just wait for a few couple of days, try to join the upcoming sessions of the recalls so that you guys can also get an idea how great you are going to pass up with the flying colors in the upcoming results are out. So waiting for the great results, my dear friends, and definitely good results, great results, excellent results are going to come even in this FMG exam. So thank you all for giving me a patient hearing, my dear friends, and wish you very much all the very best, and let us jointly pray for your great success in your upcoming exams, my dear friends. Thank you all for giving me a patient hearing, and let us wait for the great results for all of you, my dear friends. Thank you so much for joining this session, and see you guys.